everyone. Welcome to our mental health webinar. We have the centers here on the line.
I know Joseph wanted to open up the presentation, and the plan was for Patrice to talk about our counseling program, and then I would finish us off and talk about our behavioral health urgent care.
Righty. Joseph, are you in the room right now?
Yeah, I'm here.
Alrighty, everyone. Welcome, welcome, welcome. So I just asked everyone if you can mute your cell phones while you're on the call. If you have any questions, please hold off until the end of the presentation, or you can type them in the chat and I will let our presenters start. Welcome, Joseph. This is the centers. If anyone, again, if you have questions, can you please hold off until the end of the presentation, and or you can type them in the chat and we will ask the questions from the chat. Joseph, you can get started.
All right. Thank you, Kristen. Once again, my name is Joseph Dennis. I want to thank CMHA for allowing the centers to present at today's webinar, and just welcome all the residents who are on this call, and just kind of give you guys a round of applause for taking the time out to listen to the wonderful resources that we have here. And we hope that they will be of great value to you and to your families. I will start off. It sounds like before I hopped on, Keelan gave some soft introductions of our team. But I will kind of go over, like I said, introducing myself. I have my colleague, Linda Hernandez here, who is the community outreach representative for the centers. We have Patrice Treadwell, who is our supervisor of counseling. Is that correct? Cool. All right, got that. And then we have Keelan, who is are you like the assistant director now? What's going on?
I'm the manager.
Yeah,
Might as well be though.
we're gonna speak that into existence. All right, so yeah, so that is the team that we have come with today. I will start off, like I said, just by introducing myself. My name is Joseph. I am the manager of community engagement here at the centers. I've been with the centers for about 3 years now. So I've worked in the capacity of connecting our organization with other community agencies to bring awareness and connective services as far as care coordination goes to our various services under the center's umbrella. For those who may not know what the centers is and what we do, I'll give a quick overview of that. I like to describe us as a one-stop shop. We do a lot. We do a ton of things. We do a lot in the healthcare space with primary care, mental health and behavioral health, which you'll hear a couple of pieces of that uh, department or that space will be presented to you here today. But we also do dental services too. So we do things like um, consultations, cleanings, restorations, extractions, and we can also refer out for certain like cosmetic dental services as well. So to kind of backtrack on that point, we do have five health and wellness services or centers located throughout Cleveland. We have two on Euclid Avenue. One is at 46th and Euclid, and the other one is about 122nd and Euclid. It's actually the old free clinic. If anyone on this call is familiar with that location, right on the border of Cleveland and East Cleveland there. Um, and we have our Gordon Square office, which is on West 52nd in Detroit. And then we have a location in Parma or on that Parma Cleveland border on Ridge Road. And then another on Rocky River Drive in the Cam's Corner neighborhood as well. Um, a unique feature about the center's health and wellness sites, we do have pharmacies at all of our our location. Those pharmacies are operating on a 340B sliding fee scale. So pretty much what that means is that we can we can get you services and prescriptions and things like that potentially at a discounted rate if they qualify under the 340B sliding fee scale. And that not only includes our prescriptions and things like that, but certain services also fall under that sliding fee scale as well. So we are community health based, serving individuals who either do not have insurance or are underinsured. So we are at the forefront of the fight for healthcare equity, and making sure that barriers such as the ability to pay and transportation aren't things that keep folks from taking advantage of healthcare services that we all deserve. It's a right. So we are, like I said, firmly fixed in on the front lines of that fight. Um, Along with our health and wellness pieces, though, we also have some accompanying pieces under early learning and family support as well. So, like I said, a super unique one-stop shop model that we use. Our early learning programming, we have 6 early learning sites across Cleveland, located on both the east and the west side. And these are 5-star rated early learning sites. So it's a curriculum to basically get your child between the ages of 6 weeks and 5 years old, getting them prepared for kindergarten. We do have meals that are provided for the children who are on site. And we also offer a home visiting option as well. So actually a home visitor who's a teacher under the early learning program will actually come out to the home to provide resources for the little one, for mom, dad, and your child can be enrolled in this program uh, before they're even born, really. So these are like resources you can be connected with, as a mom, throughout your pregnancy. And they're just amazing resources that get you ready for parenthood, basically. So those are some of the cool items under early learning and family support. We do have workforce training as well. So we have our El Barrio program, which is located at 52nd in Detroit as well. Will actually help folks enter or re-enter the workforce for the first time. Um, and we have some amazing training tracks under that program. The first 4 weeks is just general job readiness, helping you get your resume together, helping you with your interviewing skills, your job searching skills. And then from there, you can enter into, specialized training tracks in IT and Google support, pharmacy technicians, child advocacy, just a number of training tracks that we offer in-house. Under that program, we have hiring or open interview clinics that take place at our El Barrio location as well. We have a partnership with Dress for Success, so that our clients who are looking to enter the workspace, who may not have access to professional clothing, we also have like a closet at our Gordon Square site where folks can get, blazers, dresses, dress shoes, all those things. So um, I will put actually our information around all of our programming, um, it lives on the website. I'll put that in the chat. I'll put the website, the whole entire website, the link to that in the chat. So if anyone is interested in accessing or just learning more about the centers in general, that website is a good tool to do that. It breaks down all of our service lines, and it also has a contact us tab on the homepage at the top where you can actually generate a referral for specific services that you are interested in. And those are picked up by my team. and then triaged out to whatever department that you are interested in, whether it's, like I said, primary care, mental health counseling, or if it's early learning and family support or workforce training. You have the ability at your fingertips via that tab to create a referral and get the ball rolling. Um, I really could go on and on for days. I want to, before I pass the baton, also let everyone on this call know that we will in January have our tax clinic coming up. So the dates that that is going to start are still being determined, but I do want to make everyone on this call aware that that is something that the centers does offer as well. We've been doing it for the last two tax seasons. And what this program is in partnership with the VITA, the Volunteer Income Tax Association, um, in an effort to get folks to take advantage of the earned income tax credit that is available to them, families who file taxes. So, like I said, we've been doing it for about 2 years. Last year, we actually added a component to that under workforce where folks who were enrolled in our workforce program, they were actually they were actually able to participate as volunteers to work the tax clinic, where they were able to get like hands-on experience um, preparing taxes for the community, and they were actually paid a stipend under like a continued education piece um, while working in that program. So they were getting the hands-on experience while getting paid. And then they're certified at a state level. So, they can take that and, put that on a resume, or they can use it as a side hustle if they want to. They can help prepare friends and family's taxes because they are, like I said, certified tax preparers. Um, and yeah, so a couple prerequisites for that. Well, really the only one is that you have to make the income threshold is 67,000. So if you make 67,000 or below, you qualify for that program. So I'm getting the word out about that. Like I said, the dates and times are still to come, but we'll offer that at two of our sites, Uptown and Gordon Square. That's cemented as of right now. Um, so yeah, so I know the topic of this conversation here is all about mental health. So like I said, we have our two beautiful uh my two beautiful colleagues here who are going to speak to those services, the counseling piece, the behavioral health urgent care piece. And I hope that everyone here has a pen and paper because it is a lot of great information, innovative ways to approach mental health, and we really want to uh, get the conversations around mental health out there and kind of destigmatize those conversations, and let folks know, hey, look, sometimes, you just need someone to talk to. It's not to the extreme all the time that it may be presented to, us within our communities. It's just varying levels of just taking care of your mental health. We take care of our physical health. We understand the importance of that. So, this conversation, I believe, is much needed. And so, without further ado, I believe I will pass it to Patrice. Are you ready to go? All right, cool.
All right. So my name is Patrice Treadwell. I am one of the counseling supervisors here at the centers. So we have 5 counseling supervisors at each location, and I'm actually on the west location near Cam's Corner. So I'm here today to talk about our counseling services and our case management services. So we have about 50, I think 50 counselors over our 5 sites with a wide range of specialties. So we work with people with anxiety, depression, psychosis, bipolar. Um, we specialize in various different modalities. So we work with kids as young as ooh, 4 years old. I believe the youngest we have is 4 years old, and then we work with adults up to whatever age we can stop at. We have some of our therapists are certified in EMDR, some are certified in CBTP, which is a cognitive behavioral that specializes in psychosis. Most of our therapists are trauma informed, specialize in CBT and DBT. Um, so as far as our counseling, we offer both in-person and telehealth appointments. And telehealth can be via Zoom, or it can be via phone, or it can be a hybrid option where sometimes you can do in person and sometimes you want to do over the phone. So our counselors are very flexible. Um, if you're interested in starting counseling or case management, we have an intake process. So what you'll do is you'll contact our 216-325 well number, our access department, and ask for an assessment. And so we'll schedule that mental health assessment. One of our individuals at the access department will schedule a mental health assessment. So a mental health assessment, some people become upset with it. It's about an hour long, and we're going to ask you about 1 million questions. And usually these assessments are via video or phone. Um, but we have to ask these questions to see what's going on. Like, what are your symptoms, current function? What are the issues? So just gotta get into your business where we can figure out how to help you the best. Um, so once you complete that assessment, and then also you can come into the office and do the assessment via Zoom. So we do have laptops in our office that if you don't have a private space at home, you can come in our office and do it via Zoom, meet with one of our therapists for assessment. Once the assessment is completed, um, you a referral will be placed, and it usually comes to one of the supervisors. So during the assessment, you can tell the assessor what type of therapy, maybe if you want a Black therapist, or maybe if you want a male therapist, which location you would prefer to go to. So the assessor will send a referral to either 5 of our locations, and then about a week later, you should hear a phone call or information back from one of the therapists to make an appointment, or case managers. So we do, and you can receive both case management and counseling. Counseling, the duration depends. It can be weekly or bi-weekly. We try to work around your schedule. Um, the only thing is that we don't really have appointments. Some clinicians see people after about 6. I think our latest is probably 6 o'clock. Most of the time, or most of our appointments are 9 to 5. Yeah, it's a pretty fast process. Um, and then it's a fast turnaround, so you don't have to wait a month for a therapist. We usually have availability. That's it, Joseph. It's my
Okay.
spiel.
Yeah, for sure. For sure. So, so yeah, so our counseling piece, as Patrice mentioned, we have a number of counselors and capacity. Um, One of the things that I hear voiced the most in the community, with me being out there quite a bit, is case management, counseling, things like that. Just getting connected with a case manager can sometimes take a little bit of time. We do have a team, like I said, who's, like Patrice mentioned, who's dedicated to keeping that turnaround as short as possible to get you connected and get you the services that you need. And kind of going back to, I guess, tying that into what I was speaking to earlier, is that once you're coordinated with um, case management through the centers, one of our niche things is that all those other programs become available to you. So it's not like, you have a case manager. I'm not going to throw any organizations out there, but you know, uh, they may have to go externally to find, things like basic needs. We have a basic needs resource center here at the centers that your case manager can access for you. And then having those conversations with your case manager, like, hey, I'm in need of a dental exam or something like that. We have a dentist at the centers, so that's nothing but a Teams message or an email away from being coordinated for you. So that is very valuable. Like I said, just answering the call that I hear from the community quite often of just how long it takes to get connected with services. And that's something that's just countywide, probably nationwide, if I had to guess at it. It's just, it's a lot of hard work that goes into that. And, we have not many folks in that field. It can be tough sometimes. And what about legal services? So we do have connections with Legal Aid Society. I'm on an email thread with representatives from that organization who will give me information around certain legal clinics and things like that, expungement clinics. I know El Barrio works very closely with like legal aid services because um, some of the clients that we have come through our doors are folks who are looking to access our workforce services. Some of them do have records and things like that that need to be taken care of before they can go into the specific line of work that they want to go into, or it's just a general concern. Maybe a family member, that you're looking for some sort of legal support for, we can coordinate that. Like I said, the Sensors is a pretty large network. Like I said, we do a lot in-house, and we touch on a lot of different organizations. So, going back to that case management piece, our case managers are well equipped to access various resources within the community, including legal services as well. So yeah, so I just wanted to kind of segue, and what I'll do is I'll turn it over to Keelan if you're ready for
I
behavioral
sure
urgent care.
am. I
Yep.
am going to I submitted our link for the behavioral health urgent care just for that people are able to just immediately go to our direct site. I do have a PowerPoint. I know some of you are on the phone, you might not be able to see it, but it will be uploaded. So then at some point, you'll be able to go back and find it. Okay. My name is Keelan Spear. I am the program manager for the behavioral health urgent care at the centers. Just a quick brief background. The behavioral health urgent care is one of the center's newer service lines. It's only been open about 2 years. It's also um, the only behavioral health urgent care at this moment in Cuyahoga County. I know that Ohio Guidestone has also opened one, but I'll get into kind of what makes our behavioral health urgent care different from any of them within the state of Ohio. So, the behavioral health urgent care, we provide walk-in services. What's really interesting about this is, like I said too, like it is a newer service line. There aren't very many around, but this is like to provide access quickly. So, the behavioral health urgent care, like I had mentioned, it is walk-in. We want to provide on-demand and non-invasive services. These can include anything to do with mental health, substance use, or a combination of both. We want to provide like a safety net for the community so that, prevent any hospitalizations or any type of escalation in symptoms. We want to be able to provide that support so that an individual can be successful and healthy. So the services that we offer, these are our goals. So we really want to promote wellness and quality of life within the community. And Joseph had already mentioned too that, all the other services that the centers has to offer. And in the behavioral health urgent care, we really want to focus on the whole person. So we want to get them connected to the other services that we do have within our organization. Because we know too, like if somebody hasn't seen a primary care physician, that you might not feel so great. So that might, impact or present as some depression. We also know the same thing about dental. Like if you've ever had like an infected tooth, right, you don't feel great. That can impact your mental health. So with the services that we have, we want to be able to get you the person connected. We also, again, we want to prevent any type of deterioration and focus on wellness. So we have two locations for the behavioral health urgent care. There is one at our Uptown location. Joseph had mentioned the former free clinic. We have a West Side location, Gordon Square. Each location has a team. The team consists of a psychiatry provider. So this may be either a nurse practitioner or, depending on the day, could be a psychiatrist. We have a registered nurse, a behavioral health consultant, which would be someone like a licensed social worker or a licensed counselor. We have front desk staff, and then we have myself and a care coordinator. So, depending on the needs of a person, coming into the behavioral health urgent care can look very different for one person versus another. So, sometimes people are already connected to services within the community. If somebody is not a client of the centers, you still have access to the service. And once you do access this service, this is not, it's not to the point where it's like, okay, now you can't get services anywhere else. If your preference is still to stay with another organization, we respect that. And what we would do if somebody is connected to another organization, we're going to have our care coordinator just make sure that follow-up appointments are coordinated, releases of information are sent so that records could be seen, just to provide that ongoing care. And like I said, too, you don't have to be a client or a patient of the centers. You don't have to continue receiving services here. And it's not a limit of how many times you can use the urgent care. And to think about a behavioral health urgent care, and if any of you guys have ever tried to navigate the mental health system, it can be pretty difficult because oftentimes you have to call one person and then you get an appointment for something and you might really need something else, but you have to wait for that appointment before you can get the other appointment. We're able to take care of all of this in one day. It might take a couple of hours, but what we're able to accomplish in one day could potentially take weeks to months. So depending on the need of the person, like I said, things might look different. Sometimes people come in and they only want psychiatry. They want to talk about medication. Maybe they are currently connected to someone and maybe their medications aren't working, or maybe their provider is not available and they need a refill. So somebody might come in again just to see psychiatry. Sometimes people just come in because they need somebody to talk to. We're able to link them. We're able to get that assessment that Patrice had mentioned. We're able to complete that in as a walk-in basis, and then we can get them linked to the person linked to a counselor to counseling. So we kind of can speed up the process a little bit for like counseling referrals and the assessment for that piece. And our assessments are also in person too, especially if you have a preference to meet in person. Again, then you have that option. And then two, we also have care coordination. So if there are any needs immediate needs that need to be addressed, so if it is trying to access basic needs, immediate shelter, or like obtaining a cell phone, our care coordinator is able to assist with that. Our care coordinator is also able to assist with any internal referrals. So depending on the assessments, it would determine kind of what programs you may qualify for. The care coordinator can help you get connected to those services. And the same thing too, if you want to remain connected or if you want connected to another organization, the care coordinator will help with that process as well. I do want to, so these are all things that we're able to help the behavioral health urgent care if you're experiencing any of these. So again, that mental health, substance use, or both any of those conditions. if there's maybe a change in your ability to perform daily activities. So it could be that you're not going to work, or that you're sleeping a lot later than you normally would, and you're not able to get your kids ready for school. So things like that. If there's any impairments, if your family and friends are concerned about you, maybe you're having some issues at work. If it's a child, maybe there's a change in their ability to function at school. If there's any impairment in reality testing, or communication, so if somebody's experiencing like hallucinations, they're seeing or hearing things that other people cannot hear or see. As long as the person, and then we also even see people who have some suicidal ideation without a plan or intent. So this might be people who would say, I wish I would just fall asleep and never wake up. It could also just be like, if I had the like if I felt like it, I would just jump in front of a car. So that's not saying, hey, I'm going to do that, or I plan to do that, but those are just still things, like the suicidal ideation. If again, to that medication piece, sometimes it doesn't have anything to do with medication. Maybe somebody just wants to talk to someone. And then two, if maybe the person, if you're, the person is engaging in any type of risky behaviors, and this doesn't seem to be something that is common or like of that person, if there's any significant changes. I do. So I do want to add to, some of you may or may not have children, but also too, you may have children in your family. We also see kids. We begin seeing kids at the age of 6, and children are only seen at our Gordon Square location. So we're able to see six across the lifespan, 6 years old, all the way until someone cannot engage anymore. These are all the services that we're able to provide. And maybe somebody is not sure exactly what it is that they need, and they want to come in and they want to get a better understanding. So that's that behavioral health triage. And so, if maybe you're not feeling right, or maybe you haven't been feeling right lately, and you're just not exactly sure what's going on, great, come on in. We're gonna help you out. We're gonna figure out what's going on, and then we'll come up with a game plan. Like I'd mentioned too, some people just come in to talk to someone, so we can provide crisis counseling. If somebody doesn't have any benefits, we can assist with benefits enrollment, so like Medicaid or SNAP. If somebody does not currently have Medicaid, we can actually check to see if you're eligible for presumptive eligibility, which means, excuse me, a temporary approval, so that you would be able to be seen and pick up medications. We do check in on you after you receive services from us, because we want to make sure that you are connected to the services that you really need, and that that we're thinking about you, and that we want to just make sure that you're keeping up with things. Um, we'll do a suicide risk assessment, counseling on access to lethal means. So what that means is, if somebody does present and they're, saying, hey, I want to hurt myself, access to lethal means would be asking them questions about, do they have access to things like weapons, guns, medications, if that's a plan that they have to complete suicide. We can also complete behavioral health assessments for the purposes of getting people connected to case management or the other programs that we have at the centers, including counseling. Again, we're really focused on that whole person care. Um, Joseph had used my phrase, the one-stop shop, because if somebody, is interested in receiving services from us, and, we have all these great things that we have to offer, somebody can literally leave with all the appointments that they need after they're done seeing us. And then on top of that, we have an on-site pharmacy. So then the person, if they chose to meet with a site provider, they're able to leave with medications same day in hand. The only thing too, we do prescribe most medications. There's not a medication that we're not allowed to prescribe, but we do not prescribe controlled medications. So these would be medications that can be abused. So Adderall, Xanax, Ativan, things like that. And the purpose of that is because we don't provide the ongoing care. So like once you see one of our providers, we get you connected to someone who's going to see you either monthly or every other month. Okay. Some things though too, and we do have people who come in and they require a higher level of care. If you or yourself, if there is any, or if you or anyone you know is at risk of, any harm, significant harm to themselves or others, the behavioral health urgent care is not appropriate. That would be appropriate for a call to like mobile crisis or 911. If somebody is some significant physical impairment, like maybe they could be if they're intoxicated, but to the point where, they can't, keep their eyes open or they're falling all over. If they need, a higher level of care, so such as, if somebody, like inpatient hospitalization, and or if somebody does require medical attention. We do not have, it's not a physical health urgent care. It is behavioral health. If somebody does come in though, and we have had people who come in who are experiencing some sort of medical issue, like maybe somebody hasn't taken their insulin, or they haven't been on, their diabetes, other medications in a while, we can try to get them connected to primary care as quickly as we can. We have had, that's, one of the great things about us having a registered nurse, because we do want to do some medical clearance, because if you require medical attention, that's going to be the first thing that we're focused on. Again, we have 2 locations. If you or anyone else who might benefit from our services, please, we have a number that directly calls our team. Even if you are thinking about coming in and you're just not exactly sure what to expect, please give us a call. Maybe you're not sure if this would be the appropriate place. Give us a call and we can talk about it. Another thing is too, we want to kind of eliminate any barriers there are to care. So again, if you don't have benefits, we'll see if you're eligible for them. If you're not eligible for them, we will also see, we provide a sliding scale. So sessions can be as low as $5 or more per sessions. And then our pharmacy also offers a sliding fee for certain medications. So then, we're able to help. In addition to, if transportation is a barrier, if you're like, today is my day and I would really like to be seen, but you don't have a way to get here, give us a call and we can get you here and we can get you taken care of. Because sometimes if today is the day for someone, we want to catch that person today, because we don't, because they could change their mind, and then, they can, or they can deteriorate, or escalate. So, we want to be here to catch them before they really fall. So, all right. There might be, I'm not sure if there's questions.
I think we
Okay.
also
Yeah.
forgot to
So,
talk about our SUD program and Matt.
and actually the question or the, with Matt too, we also offer walk-in Matt services at our Gordon Square Behavioral Health Urgent Care. But just to note that the medications we use are Sublocade, Suboxone, and Vivitrol. So there are some people who are part of a methadone program. We do not have that here at the centers, but we can get you connected to that program if that's the case. Also too, with us, we do utilize the Epic medical record. So, if you have been around, if you've received services from, major hospitals like Metro, University Hospital, Cleveland Clinic, even places like Neighborhood Family Practice, Signature Health, they all use the same medical system too. So then we're able to get a background information about you. And if you are already in the Epic system, we're able to speed things along too. So then you don't really have to worry about that registration piece or intake piece.
Yep. Appreciate it, Keelan. And I appreciated Patrice too. I saw there were some questions that you answered in the chat. So yeah, thank you for that. Just to highlight a couple of pieces from Keelan's presentation, with behavioral health urgent care being a fully walk-in clinic. And then the last piece that was mentioned, the walk-in MAT services. So I just want like, folks on this call to really understand like how, groundbreaking that is in the sense of like in the concept of meeting, the community where you are, right? So um sometimes like scheduling appointments, if you're in like those pre-crisis spaces, and you're needing to see someone like, now, we have structure around, walk-in services where you can come in and you can have all these wonderful things coordinated around you within a matter of hours, right? So, like I said, truly groundbreaking uh system that we've been able to create here and bring to the community. The urgent care has already seen thousands and thousands of folks and been able to assist in their mental health needs and get them coordinated with other services too, whether they're within our organization or if they're elsewhere. That piece about the Epic platform, very, very vital. Once again, going back to my experience and talking to, community residents, is that, hey, I already have a provider with Cleveland Clinic. And it's like, that's fine. We love Cleveland Clinic too. We partner with Cleveland Clinic for a couple of our initiatives, including mammogram screenings and things like that. But what I always leave on the table for folks is that you know sometimes having a backup, right? If we can serve as a backup to your provider at Cleveland Clinic, sometimes, I think we can all agree on this call that Cleveland Clinic is a very large organization, and sometimes scheduling is not that great of a time. So, you may be scheduled 2 months out for something that you need, either right now or within the next few days or so. And we may be able to assist with that. So, I encourage folks to not, you know, ex explore the options and resources that you have here, uh, and put all your eggs in one basket, because we may be able to service you. Just, we're confident that we will serve you just as well as the Cleveland Clinic, if not better. And 6 years old. Oh, I'm reading through the chat. So so yeah, so I want folks to on this call to take in this information for yourselves, for your loved ones. Like I said, these are services for I'm seeing in the chat here, like 6 years old, like these are for children and adults, right? So if you do have little ones, um like please invest in their health as well, and the barriers to care, the transportation pieces, we have remedies for that. The accessibility as far as paying for services, we have remedies for that. So everything in this program is really tailored to the community, and it is what you make of it. Before I started working here, I knew of the centers, but I didn't know everything that the centers did. Like I didn't know it was this extensive. And if I had, I would have been screaming this from the mountaintops a long time ago. But now I do know, along with the rest of the group here on this call. Uh, you've been informed, and there are resources in this chat, and online where you can look us up because even I'm still learning about all the things that we do. We do so much. Um, just kind of as an update too, we've recently purchased the medical arts building of St. Vincent's Hospital. So we'll be there in 2026, and we'll be offering uh, some healthcare services within that space as well. We recognize the need to uh, place services back within like the central community and kind of like that near east and west side of Cleveland. And St. Vincent's was a community staple for a very long time. So we're happy to have acquired that space and be moving in there in 2026. But now is the time for the community to access our services. Leading up until that time, so that you're already, established with us. You're able to see what our services are all about. And we're all about education. We're all about education and giving you the option to, utilize our services moving forward for yourself and your family. Or if you say, hey, you know, this didn't quite work out that well for me, you still have that option to explore your other options. So we are here very much so as a community resource for you to use at your own discretion. But hopefully this information that we were able to present today, hopefully you take it with you and you give it some thought. And hopefully we will be able to be assistance to you and your families in the days, months, weeks, years ahead. So, if anyone has any additional questions, I'm not sure, Anna or Kristen, if you want to pop back on and if we want to
Yes. Hi,
Q&A.
everyone. So thank you guys. This was a plethora of information. And just recapping, I know it was so much information. I believe everyone that spoke on the chat did put their websites. If anyone have any questions, please, I don't know if you guys have all of our contact information. My lovely co-host Sabrina can put any one of the case managers information. Just recapping the centers, if you guys do not know, they have health and wellness, they have early learning, they have dentistry, they have actual doctors as well. Like they were saying, it is a one-stop shop. So if you guys are interested, there's different locations. Don't ask me how I know this much information. I'm just smart like this. No, I used to work there. But you guys, please tap in. If you know who your case manager is, you have Anna Santiago's contact information. Sabrina just put hers. Sabrina, I don't know if you have mine. I'll put my contact information. If you have any questions, if you need help, they are a plethora of information. They have everything you need. And again, if anyone has any questions and you want to unmute yourself, please feel free, or you can type it in the chat. Alrighty, Anna or Sabrina, did you guys have anything to add?
Yes, I just had a couple quick announcements. Can you guys see me okay?
Let me see. No, I don't
No,
see you, Miss
but you can
Sabrina.
hear me, so that's good.
I can hear you. Yeah.
Wonderful. I just wanted to say really quickly, thank you so much to the centers, all the folks over there for disseminating such wonderful information. Thank you so much to everyone that joined today. I'm Sabrina Johnson. I'm one of the Family Self Sufficiency coordinators here at CMHA. And I just wanted to encourage everyone to stay connected, stay tapped in with CMHA. You can check out our website, which is cmha.net, for, upcoming initiatives, new projects, different events that we're hosting. We also have a YouTube channel, an Instagram, and a Facebook. So you're always able to stay, again, connected with your local housing authority. Also, we are having a job fair on November 14th. So if you haven't already, please mark your calendars and spread the word. Again, it's going to be on November 14th from 2 p.m. to 4 p.m. So we're asking everybody to come dressed and have their resumes ready, because there will be some on-the-spot interviews. And this go round is going to be held at our Cedar High Rise in the community room. So, of course, we'll be sending out the flyer And if you have questions, please feel free to reach out to Kristen, myself, your case manager, or your coordinator for more details. Thank you, Kristen.
Thank you, Miss Sabrina. All righty. Well, you guys have all the contact information. If there is no more questions, I'm assuming we can go. Again, I believe everyone's contact information is in there. If anyone needs help or just like connections, if you lose information, please feel free to reach out to your case manager, Anna Santiago, myself, or Sabrina, and we definitely can get you connected. All right, everyone. Have a good evening and be safe, everyone.
Thank you all.
Bye-bye.
Everyone, take care.
Hi, to the person who just asked the info for the clothing, etc. Can they please send to my email? You have to be connected with some of their services in order to use their pantry. So you have to either be in their workforce development, early learning, or be connected with their counseling services. They don't distribute clothes unless you're in their program. And this is for the Samsung person who had the question. All righty, thank you.